Mr. O'Connor. My name is Kelly. I'm going to be your nurse today. How are you doing? I'm closing the door to provide privacy, and I'm performing hand hygiene. Okay. Okay. So, Mr. O'Connor, I just performed hand hygiene and I shut the door for privacy. The first thing I'm going to do is verify who you are. Can you please tell me your first and last name?
Yeah, Peola O'Connor.
All right, and Mr. O'Connor, what's your date of birth?
12/4.
Okay, do you have any allergies?
No, I do not.
Okay, and I have a medical record number of 8442515. All right, excellent. The first thing I'm going to do is I'm going to take a quick set of vital signs. Is that okay?
Okay.
So I have a blood pressure of 150 over 101. I'm going to put this little probe on your finger. If you'll just leave it on there, that's measuring your oxygen saturation.
Okay.
I have an O2 sat of 89% on room air. Put this under your tongue.
Temp is 99.9.
99.9 is my temperature. I have a heart rate of 129. I have a respiratory rate of 27. All right, Mr. O'Connor, do you have any pain today?
Yes, I do.
Okay, where's that pain located?
I have a headache.
Okay, a headache. On a scale of 1 to 10, what number would you rate that pain?
About a 3.
Okay. Does it radiate anywhere?
No.
Can you describe the quality of your pain?
It's just achy.
Okay. Sharp or dull?
No.
Okay. Is there anything that makes it better?
Yeah, the other, no, nothing really is helping right now. I'm getting these, the lights look kind of yellowish green.
Oh, okay,
Kind of
great.
like halos.
Okay. And then, is there anything that makes it worse?
Yeah, light makes it worse.
Okay, so as soon as I'm done with your assessment, I'll turn down those lights and give you some relief that way. And then I'll call your doctor and let him know.
Okay, great.
Okay, great. So I'm noticing that your fingers look a little bit cyanotic. I'm going to start you on some oxygen because I do have orders that you can have up to 5 liters to keep your sats at greater than 93%.
Okay.
So I'm applying this. You're going to feel a little bit of blowing up your nose, and I'm putting it on 2 liters. All right, I've got some improvement. Are you still having a hard time breathing?
A little bit, yeah.
All right, I'm going to move you up to 3 liters then. And take some nice deep breath through your nose. Okay. All right, that number looks a lot better.
I'm feeling better, thank you.
Okay, good. So now I'm going to do a head-to-toe assessment and then give your doctor a call and let him know what my findings are.
Okay.
All right, so the first thing I'm going to do is I'm going to check your pupils. Okay, and follow my finger. Perla is present. I'm going to check your mucous membranes in your mouth. I know that your mucous membranes are pink, moist, and intact. Mr. O'Connor, do you know what today's date is?
It's August 5th
Okay, do you know where you are?
in Fortis Hospital.
Okay, great, and do you know why you're here?
Having some trouble breathing and think it's from my heart failure.
Okay. All right, I'm going to take down your gown now, listen to your lungs, heart, and then do an inspection of your chest.
Okay.
Okay. Checking for skin turgor, and I know that the skin is non-tinting. Mr. Akana, do you have a cough?
Yes, I do.
Is it productive?
Yes.
What color is your sputum?
White.
Is it thick or thin?
Thin.
Okay. And in this medicine cup, about how much would you fill up?
Oh, about that whole thing.
Okay, great, thank you. Okay, so chest rise and fall is even and symmetrical. Respiratory rate is even, rhythm is unlabored, and depth is shallow. I'm gonna listen to your lungs now. I'm going to listen to 8 positions anteriorly and 10 positions posteriorly. Mr. Akana, you got some crackles going on in those lungs. We'll see what we can do to take care of that. Now I'm going to listen to your heart.
Okay.
I'm going to start in the second intercostal space on the right at the aortic. Second intercostal space on the left is the pulmonic. Third intercostal space on the left is herbs. Fourth intercostal on the left is the tricuspid. Fifth intercostal midclavicular line. I'm listening to the mitral valve, and I'm going to listen here for 1 full minute. I have an apical pulse of 115, S1, S2, and S3 are present. Just get you covered back up here so you don't catch a chill. Now I'm going to assess your arms for your brachial pulses. +2, radial pulses. +2, capillary refill. Less than 3 seconds. Push up.
Okay.
And push down.
Yep.
And grip my fingers.
Okay.
I note +5 strength in the upper extremities. I'm looking at your IV site. The dressing is clean, dry, and intact. It is dated for today. I see no signs of redness, swelling, or infiltration. Do you have any pain right here where your IV is?
No, I do not.
Okay, and then I'll flush it when I come to give you your medication. Okay, now I'm going to take a look at your abdomen. I'm going to look first, and then I'm going to listen, and then I'm going to push on it a little bit, okay?
Okay.
All right, so I know that the abdomen is slightly rounded. No mass is noted on inspection. Now I'm going to listen to the 4 quadrants, and I'm going to start at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, I know active valve sounds in all 4 quadrants, and I'm going to palpate. Tell me if you feel any pain. Right lower quadrant,
No pain.
right upper quadrant,
No pain.
left upper quadrant,
No pain.
and left lower quadrant.
No pain.
Okay, excellent. Now I'm just going to inspect your genitals.
Okay.
And upon looking at his genitals, I notice that there are no lesions, abnormalities, edema, discharge, or sores. Mr. O'Connor, when was the last time you had a bowel movement?
Yesterday?
Yesterday, okay, and was that normal?
Yes.
Okay, what color was it?
Brown?
What was the consistency of your stool?
Kind of watery.
Okay, small, medium, or large amount?
Large.
And any unusual odor?
Just normal.
Okay. Okay, when was the last time you urinated?
About 9 hours ago.
9 hours ago? Okay. So I do note that we have some orders here, for a Foley catheter to be inserted, so maybe that'll help you out a little bit. What color was that urine?
It was amber, I guess I'd call it, like a dark yellow.
Okay. Was it clear or cloudy?
It was clear.
Okay. Any unusual odor to your urine?
Yeah, kind of a ammonia, strong smell, like ammonia.
Okay. And then in this urinal, can you tell me about how much you were able to void?
Yeah, about that mark that says 100.
Okay. Any pain when you voided?
No pain.
No? Okay. Any sense of urgency?
No.
What about frequency? Is it more, less, or the same?
Definitely less than usual.
All right, I'm going to take a look at your lower extremities. All right, noting that the lower extremities do have +3 pitting edema. I'm going to check your pulses now. I'm looking at the dorsalis pedis pulse. +1. Posterior tibialis. +2. Checking for capillary refill. Greater than 3 seconds. Can you push against my hands? +5 and pull back.
Okay.
+5. All right. Now I'm going to perform hand hygiene. Cover you back up again with your blankets. All right, Mr. O'Connor, now I'm going to go call your doctor and let him know about my assessment findings, okay?
Okay.
Hi, Ann. This is Kelly calling from Fortis Hospital. I'm taking care of Keola O'Connor in room 148. He was admitted with complications to his heart failure.
Okay.
It looks like his past medical history. He's got a history of AFib. Was just started on digoxin 3 days ago. He's experiencing worsening shortness of breath and dyspnea at rest. He showed up today for cardiac rehab, and his primary ordered him a direct admit.
Okay.
On assessment, I note that he has +3 pitting edema, bilateral lower extremities. He has crackles in all lung fields. He's got a notable S3 heart sound. Additionally, he was not on oxygen when I went into the room, sounding at 89% with some mild cyanosis in the upper and lower extremities. Titrated him up to 3 liters, got him to 93%, and the cyanosis has since resolved itself. Looked at his labs, and I know he's got an elevated BUN and creatinine of 40 and 2.3. He's got an elevated potassium of 5.8 and a digoxin level of 2.3. Of note also, he complained of a mild headache and halos, yellow halos on his vision. So I want to recommend maybe giving him some K-Exolate in hopes of bringing down that potassium level a little bit. And then I'd like to hold the digoxin for today, since he is exhibiting some signs and symptoms of dig toxicity, and his level is at 2.3.
Okay. What is he getting is he getting any furosemide right now?
Let's see what we've got him ordered. Right now we have him 20 milligrams IV push first dose stat.
Okay, why don't you give me the furosemide 20 milligrams right now and change that to furosemide 40 milligrams IV, BID, first dose now, so we can get some of that fluid off. Continue you to hold the digoxin and read your in the AM, digoxin level in the AM. And you can give them a one-time dose of the Gaslate, 15 grams oral.
All right, may I read these orders back to you? I'd like to discontinue furosemide 20 milligrams IV, start furosemide 40 milligrams IV twice daily, first dose now,
Yeah.
hold the digoxin, draw level in AM, and K-Exalate 15 grams PO.
Perfect, and I'll be up to see you shortly.
Okay, great, thank you so much.
Thank you.
Bye. All right, so Mr. Akama, I just got off the phone with Ann Meyer, your primary care's nurse practitioner. It looks like we're going to increase your furosemide dose and give you a little bit extra to try to pull some of this fluid that's in your legs and in your lungs off.
Okay.
I'm going to hold your digoxin for today because you seem to be exhibiting some signs and symptoms of toxicity, namely that your level is elevated and you've got the headache with halos. I'm also going to be giving you a medicine called K-Exalate. K-Exalate is a liquid medicine that you'll drink. And what that does is it binds to the potassium that's in your system, makes you have bowel movements, and that will bring your potassium level down to a less dangerous level. Do you have any questions about those meds?
No, thank you for explaining that to me.
Sure, no problem. I'm going to go grab your meds, and I'm going to grab your Foley catheter too and get that inserted, and I'll be right back in a second.
Okay.
Okay, now in the meantime, I've got your call light in your hand. If you need me before I come back, you just press that button and I'll be right back in. I've got your bed wheels up. I've got your bed down in its lowest position. Is there anything I can bring for you additionally when I come back?
I'm all set. Thank you very much.
All right, I'll be right back.